Hi, my name is Dr Ranj Singh and I'm here today with haematology consultant Dr Priya Sriskandarajah to talk about lymphoma. Let's start at the beginning. What exactly is a lymphoma?
So a lymphoma is a cancer of the lymphatic system. So there's glands in the neck, in the groin, in the armpits and in the groin area. And you can see all these tubes that connect them up, which drain fluid. And what happens in lymphoma is some of these glands become cancerous and become enlarged.
And typically, where might you find those cancerous glands?
So mainly around the neck, which I've highlighted here. Some people notice it in their armpit, and then a lot of people also notice it in the groin area too.
And there are two main types of lymphoma, aren't there?
Yeah, that's right. So there's Hodgkin lymphoma and non-Hodgkin lymphoma, which we treat very differently. Today we are focusing on non-Hodgkin lymphoma.
Why do patients usually go to see a doctor? What sort of symptoms might they have?
So typically patients may notice that either they're getting enlarged glands which are painless and they're not going down, they're having high fevers, drenching night sweats, or they're losing a lot of weight. Some of them may have bleeding or bruising symptoms, and some may even have recurrent infections.
Thank you. We're going to be talking more about those in just a moment. Earlier, we spoke with Jordan, who was diagnosed with lymphoma as a teenager.
Before I was diagnosed, I hadn't long turned 17. I had just started sixth form and doing my A-levels, and I'd actually just started a part-time job. So it was just pretty normal, just being a normal 17-year-old really. The first symptom I experienced was a lump in my side. So I went to the doctors and it was kind of brushed off. They didn't really say much about it or say really what it was. It wasn't till maybe like a year later I had really itchy legs. I'd actually had fatigue really badly. I'd fall asleep at about 5-6 p.m. in the evening. I'd be sweating all night long. But it was summer and I was tired. I'd just done my GCSEs. Like, you didn't really put it all together. But with the itchy legs, the lump, the night sweats and the fatigue all together is what created my diagnosis.
So if someone comes to you with symptoms, what sorts of tests would you do?
So we would start off with doing blood tests, and then what we would do is some imaging, including a PET scan, which I will show you here. And the reason we use a PET scan, it shows us how active these lymph nodes are and which one could be lymphoma. And we would talk about places that are lit up. So for example, this area is very lit up, so we would be more concerned whether there could be lymphoma there. So we would actually specifically target those glands for a biopsy. So we would take some tissue, look under the microscope to take a closer look at them.
So you use the PET scan to show up lymph nodes that might be problematic,
yeah,
and then you know which ones to go in and biopsy and take a closer look.
Exactly.
What else can a PET scan tell you?
So it can tell us whether the people have an early stage or advanced stage. So early stage lymphoma is where when you look at the PET scan, the glands are lighting up mainly above the diaphragm. So here in the armpit and in the neck area. So advanced stage lymphoma on the PET scan is where you have glands lighting up above and below the diaphragm. So here we will see some light up in the tummy area and in the groin as well. And then following on from this, we will do a biopsy of one of the glands to look at it more closely.
And what exactly does a biopsy involve?
So the biopsy is where we call it a core biopsy. So we take a core amount of tissue, we look at it under the microscope, and we're looking specifically at the cells to see is it a low grade or high grade type of lymphoma.
Okay, so the biopsy gives you more information about what type of lymphoma it is and
Absolutely.
how severe it is.
Exactly.
What's the difference then between high grade and low grade?
So when we say low grade, this means that the cancer cells are dividing up more slowly. So generally these types of lymphomas will have a more slow growing course. In high grade, they're dividing more quickly. So we know it's a little bit more aggressive and it will mean that it will alter our treatment for them.
If you are diagnosed in the early stages, what does that mean and how does the treatment differ for low grade and high grade lymphoma?
So for early stage, if it's low grade, often what we tend to say is we will watch and wait. So we will monitor the patients over time. Sometimes if it's low grade and localized somewhere, say for example in the neck, we might offer more localized radiotherapy.
How does radiotherapy work and how does it differ from chemotherapy?
So radiotherapy is more for localized lymphoma. So for example, in the neck area, it's a beam of rays that we give that essentially target these cancer cells, but at the same time, some of the healthy cells are also affected.
So just because they happen to be in that same area that you're treating,
Yeah.
the healthier cells can also get damaged.
Exactly.
And is that what gives you the side effects?
Yeah, so some of the side effects people get with radiotherapy, they can get very tired. Some of them, especially in the neck area, can get quite irritation of the skin as well, and they can get a sore throat. So these are things that they need to be aware of. In people with high grade, we would offer them chemotherapy.
Explain how chemotherapy actually works.
So in terms of chemotherapy, what we're trying to do is we're giving drugs to target these cancer cells, which I'm pointing at here. However, the issue with the chemotherapy is that these healthy cells also get targeted too. And that's why people often get side effects with chemotherapy.
Why is that? Why does chemotherapy target all cells like this?
It's mainly because it's not very specific. So it's essentially trying to kill these cancer cells which are dividing up very quickly. But the problem is some of our healthy cells also divide up quickly. So they end up being a sort of bypass damage as well.
So that's why people would get side effects, because you're affecting healthy cells that also just happen to be dividing rapidly.
Exactly.
Where would you find those sorts of cells?
So typically we tend to see this in people where they get soreness in the mouth, they might get some tummy issues, so either they feel sick and they may develop some problems with their bowels as well. And what we tend to do is we give them a lot of supportive treatment to get them through their cycle of treatment.
But the idea is with chemotherapy to kill these cancer cells.
Exactly.
And hopefully not do too much damage to the healthier ones.
Exactly.
How would you treat a low-grade lymphoma picked up at an advanced stage?
So in a low-grade lymphoma picked up at an advanced stage, we do tend to use a combination of chemotherapy. So this will be different types of chemotherapy drugs that will kill off the cancer cells. And often with this, we would give steroids as well.
So you're using chemotherapy and extra medication on top of that as well?
Yeah.
What about high-grade lymphoma at a late stage?
So high-grade lymphoma is a little bit more tricky. Often in these cases, people are admitted into hospital. We give pretty intensive regimens of lots of different types of chemotherapy drugs, and the aim of this is to kill off the cancer cells very, very quickly. So again, this will be including different types of chemotherapies, plus some steroids. Maybe we may give something called immunotherapy. And what we mean by immunotherapy is that it's targeting the specific cancer cell, so it's much more targeted.
Talk me through how immune therapy works.
So when I was talking about chemotherapy earlier, so this is much more standard treatment which does kill the cancer cells but may accidentally kill the healthy cells as well. In immunotherapy, the types of treatments we use, we are inducing the immune cells to produce antibodies, which look like this, and these then target the cancer cells specifically to kill them off.
So they wouldn't necessarily affect your healthy cells then?
No.
And is that why immunotherapy is better than chemotherapy in this case?
In this case, yes, because you don't get as many side effects because you're not impacting the healthy cells either.
And would you consider radiotherapy in these cases as well?
We may do. It really is depending on where the lymphoma is. And if we feel it's in a dangerous place, we may liaise with the clinical oncologists who do this to discuss this further.
Thank you for those explanations. Earlier, we spoke to Jordan, who told us about the treatment she had and some of the side effects.
So the treatments that I've had in the last 10 years, I started off having chemo. So the first time I had chemo for about 6 months. And then the second time I had chemo and a stem cell transplant using my own cells. And then the third time I had a targeted antibody chemo, some immunotherapy, and then high dose chemo before a donor stem cell transplant. So I think the earlier chemos from about 10 years ago were so much harsher. So I had so much more side effects from those. I was quite sick. I had really bad mouth ulcers. I was so tired all the time. But with the later treatments, I didn't find as many side effects. It was kind of the mouth ulcers, but I never got any sickness with things like immunotherapy. And yeah, still tiredness, but more manageable side effects, I think. Obviously with the stem cell transplants, they're also quite harsh and you have to have the high dose chemo. So that's when I kind of had a few reactions to some treatments. I had a few rashes, and the mouth ulcers really badly from that. I think life right now for me is good. I think when you've been in hospital so much, you just dream about what life is going to be like. I've had a lot of hospital appointments up until this point, but actually yesterday I went to the hospital and they don't need to see me for a year. So for me, that's quite a good milestone. And I've been in remission for 2 years. And yeah, I've gone back to work. I'm starting to book holidays. And I think it's just a sense of a bit more freedom, which is really nice.
Thank you so much to Jordan for sharing her experiences with lymphoma and treatment, and also to you, Priya, for your really helpful explanations. Remember that the most common symptom of lymphoma is a painless swelling or lump in the lymph nodes in the neck, armpit or groin. Other symptoms can include heavy drenching sweat, unexplained bruising or bleeding, or repeated infections. Always see your GP if you're worried about any symptoms that you might have. And if you want more information or support, just call 0808 808 0000 or visit macmillan.org.uk. And before you go, if you found our conversation on lymphoma insightful or useful, then please don't forget to hit the subscribe button. You can also like this video and share your thoughts or questions in the comment section below. Thank you so much for watching.